Hi guys, welcome to today's video. My name is Enorita James. I am a clinical research scientist of over 22 years experience. Today, I will be talking about the different treatment methods that are available for breast cancer. Now, if you do not know much about cancer or what it is or how it comes about in the body, I have a video I will link towards the end of this video that you can also listen to. Because as I said in that video, the fear when one is diagnosed of cancer is due to lack of knowledge, lack of what do I do now, lack of am I going to die? When you have that fear and you really don't know what to do, it compounds the fear. So as I said, and as I always say in my videos, I am not speaking from a point of a scientist. I am speaking from a point of somebody that has also gone through breast cancer diagnosis, breast cancer treatment. So I'm speaking from a point of knowledge and experience of having gone through, and also from a point of being a scientist. In this video, I'm going to be talking about the different treatment methods that are available for you if you or somebody that is related to you has been diagnosed of breast cancer. So let's go straight and let me talk about the different treatment methods that are available. Now, I divided the cancer treatment methods into these 6 different treatment methods. I have gone through this, and this, which I'm going to explain what it means in a few minutes. There are different kinds of treatment now. There are new kinds of treatment that are actually called targeted therapies, which I didn't mention here. I'm just particularly interested in letting you know the most common breast cancer treatment methods that are available for you or for anybody that you know that has been diagnosed of breast cancer. Now, the very first one here is lumpectomy. What is lumpectomy? When you get to your doctor and you complain of a lump in your breast, which could be in the lobules or it could be in the tubules, in the tubes or ducts. Some doctors first do a biopsy. If you don't know what a biopsy is, I have a video that I explained what a biopsy is. I think it's my video on different kinds of breast cancer. I think I'll link it here, somewhere here, so that you can go watch it and understand what that means. After a biopsy, some doctors will want to remove that lump completely from the breast. And when that is done, some tissues are also removed, not just the lump, but tissues surrounding that lump are removed. Now, this process of removing this lump and the tissues is what is called lumpectomy. After a lumpectomy, most doctors send you for a chemotherapy sessions, different chemotherapy sessions. And the sessions actually depends on, the stage of whatever the breast cancer was. Now, what is chemotherapy? Chemotherapy is the use of very strong chemicals that destroy the fast multiplying cancer cells. But the challenge with this kind of treatment is that it does not only destroy the cancer cells, it also destroys your normal cells. That is why the side effects of this particular treatment is very, very high. Side effects like nausea, vomiting, weakness, darkening of your nails, getting fat, most times because the treatment also involves you being given cortisol as a kind of protection of your organs from the effect of the chemicals involved in this therapy. And among other kinds of side effects, another side effect is that you lose your hair. Not everybody does, but most times 60% of cases of those that have gone through, like me, I lost all my hair. You can lose your hair, you can get dark nails, darker skin and all that. The side effects is really bad. That is why I've gone through this and I wouldn't want people to go through it. That is why I keep emphasizing on prevention. Now the third one is the radiotherapy. So what's the difference between this and this? This is normally given through the veins. The very strong chemical drug is given through the veins and it goes through, destroys these cells. But radiotherapy is localized to the particular place that the cancer cells are to be destroyed. Radiotherapy is a cancer treatment that uses quite high doses of radiation to kill cancer cells and also shrink tumors. Most times it is used in combination with this, after this. The radiotherapy treatment is normally done in a couple of days, daily. For instance, in my own case, I did it for 30 days every day. A few minutes of exposure to the radiation directly at the point where you have where the cancer tumor was removed. This is to actually ensure that if there's anything remaining after this, to be dealt with through the radiotherapy. Of course, the radiotherapy also has side effects, and most of the side effects can include fatigue. You can also lose your hair. There can also be a kind of memory problems, nausea and vomiting. You can also have some skin changes, headaches, and for some people they can also complain of visions that is not too clear. You'll be having some kind of blurry vision when you've gone through this particular treatment. Anti-angiotherapy. That's a mouthful. But this tends to make use of what is called angiogenesis inhibitors. If you don't know what angiogenesis means, I have a video where I will link right here when I was talking about what cancer is, what causes cancer, what causes all these strange growths in different organs of the body that can result in cancer illnesses. So if you watch that video, you understand what angiogenesis means. So how does anti-angiotherapy, how does it work? You find out that these angiogenesis inhibitors, they are unique kind of cancer fighting agents because they block the growth of blood vessels that support tumor growth rather than blocking the growth of the tumor cells themselves. So you're beginning to see the difference between all this. This kills the cells, this removes the lump, this deals with any other kind of cells remaining and reduces the size of the lump if the lump is there, that is if the lump has not been removed, while this actually attacks the process whereby the lumps is being fed and causing it to multiply. So this is the treatment, is a kind of targeted treatment of cancer. Hormone therapy for breast cancers. This is normally treatment for breast cancers that are sensitive to hormones. That is breast cancers that feed on hormones, particularly to hormones, estrogen and progesterone. Now, to understand hormone therapy for breast cancers, I have a video where I talked about understanding hormone receptor status of breast cancer cells. So when you understand, if you go through that video, you understand the basis for hormone therapy treatment of breast cancer. The most common forms of this hormone therapy for breast cancer, they work by two ways. First, they can work by blocking hormones from attaching to the receptors that are on the cancer cells, or they also work by decreasing the body's production of the hormones, and those ones are the ones that are called aromatase inhibitors. When you understand this kind of treatment, you will now understand some of my videos where I talk about eating foods that act as natural aromatase inhibitors. The challenge with this is that most of the hormone therapy drugs also have very bad side effects, I must say. Some of the side effects of these aromatase inhibitors can include headaches, dizziness, very serious dizziness, joint pains and muscle pains, osteoporosis, that is thinning of your bones, making it prone to quick fracture or things like that, because of the reduction of the hormone estrogen. There are certain foods that can actually do this. There are certain natural occurring aromatase inhibitors. When you go to my channel, I talk about a lot of foods like the pomegranates, like the arugula leaf. There are a lot of fruits that can do that, and they do not have these side effects. As I said, preventing going through all this is much better than actually going through it. And believe me, I'm talking from experience. And the very last one is what is called the mastectomy. That is the complete removal of the breast. This for me is much better. You completely remove it. Then you can do a little of this and a little of this, rather than this, because if you do this, there's a likelihood of it returning. But if the breast is completely removed, like me, I removed mine completely and had a surgery to build it back from my abdomen. So this mastectomy is also a good way of completely removing the breast tissues, all the breast tissues. And there are a lot of surgeries today that even when you remove this, if you want to remove remove it, your breast can actually be reconstructed using tissues from your abdomen, just so that you have balance and be able to also feel okay. So today there's a lot of ways this can be handled, and handled well. So those are the 6 breast cancer treatment methods I want to talk about in this video. I don't want it to be too long. There are other methods that are developing every day through clinical trials, which you can research in your internet and find out. But these are the basic ones that is good to know, that there are treatment methods if one is diagnosed of breast cancer. In my next video, I'll be talking about how you can prevent all this. There are ways you can prevent this naturally. It might not be 100%, but at least there are simpler ways, which is always better to avoid going through all this. So thank you for listening, and see you in my next video.